CTV's Tracy Tong joins us now. She is at Brampton Civic Hospital with some shocking statistics. Tracy, the hospital treated thousands of patients in the hallways. So what's going on there?
Well, Ken, what we have here at Brampton Civic Hospital is an overcrowding issue. The emergency department is built for about 90,000 patients a year, but over the last fiscal year, it saw about 138,000 patients, creating a shortfall that some are now calling a crisis. They call it code gridlock when the emergency department is so overcrowded, patients are treated on stretchers in the hallways. It lasted 65 days at Brampton Civic Hospital between January and April.
I was dubbed as hallway patient number 1.
Jamie Lee Ball was treated in a hallway for 5 days for internal bleeding.
I was in so much pain that I actually collapsed on the floor, screaming in pain, so that's when I finally got a stretcher.
Similar stories echoed by more than 4,300 hallway patients at Brampton Civic Hospital within a year. Tony DeClara was admitted twice within 2 weeks, left in hallways for 9 days.
Whenever the stretcher had to get through, they had to move my privacy walls and that, or sometimes they'd bash into them.
The William Osler Health System says they are overburdened. They're asking the province for $30 million for their 2 hospitals. $11 million would go to Brampton Civic Hospital to address unfunded and hallway beds and to open 2 more operating rooms.
They do not grasp the severity of the overcrowding and hallway medicine crisis that is inside Ontario's hospitals.
Ontario's NDP leader blaming the Liberals for underfunding hospitals.
It is unacceptable. And look, this Liberal government for a decade now has been squeezing the hospitals. People deserve so much better than that.
28 new inpatient beds, acute inpatient beds for the William Osler system, and more across the LHIN. There's 31 additional beds that have yet to be allocated.
Last week, the health minister announced 2,000 new patient beds province-wide, 6 of them going to Brampton Civic.
This is a crisis, and to know that Queen's Park has only allotted 6 more beds that are funded is a huge slap in the face for Brampton.
I might be in there a week or so.
DeClara is returning to Brampton Civic for a gallbladder surgery in December. He hopes he'll finally get a hospital room. And in a statement to CTV News, the William Osler Health Centre says they are working with the Central West LHIN and with the Ministry of Health and Long-Term Care to currently address their access challenges. Back to you.